Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 3rd of February 2021. I'm going to start with some numbers. And today we're showing 96 COVID positive patients in our acute beds. That's patients who are within 14 days of their first diagnosis. So that number of 96, when I look back across the data, is the lowest we've seen in this hospital since the middle of October last year. And so that gives us some feel of how we've had a second wave of COVID in the autumn leading up to Christmas. We had a slight dip moving into Christmas, and then absolutely a third wave which peaked at 171 positive inpatients on the 18th of January, and then we've seen a steady decline since that time. So last week I reported 126 against today's 96. I think though what we see in the community figures, which are also dropping a little bit, so Blackpool's figure is 229 per 100,000 compared to 243 last week. Fyldes is 272 compared to 321. Wyre is 241 compared to 261. So we're seeing some gradual reductions there too, but actually those numbers are still pretty high in the 200s. I feel we've got used to seeing a kind of high background level, and those numbers are of course baking in then some illness which is still coming through into the hospital and for people being poorly at home. So it highlights the ongoing importance of the usual messages about the key, of course, being hand washing, face coverings and keeping safe distance. We've agreed across the Trust and in fact across the NHS in Lancashire that we will ask all visitors to use our normal surgical masks when coming into hospital. So if you're coming in wearing a cloth mask, please don't be surprised to be asked to change that to a surgical mask. We think that means we can be just that little bit tighter on infection prevention and control standards across the Trust. So the newspapers this morning and driving into work, a lot of the news was about the passing of Captain Sir Tom Moore at the age of 100, who had been such a champion for the cause of the NHS. So we remember him today, but frankly we also remember the 27 people who've passed away of COVID in our hospital in the last week, and our own sad total of in excess of 650 deaths with COVID. So it constantly reminds us what a dangerous illness this is, and although the numbers do appear to be coming down, we're still not out of the woods, and we need to remain vigilant. The upside story is around vaccinations, of course, and as a trust we've immunised now over 13,000 staff and patients and colleagues across the health and care sector. And of course the big numbers are now being done in the Winter Gardens in Blackpool and through GP and primary care network settings across the area. And so the messages there are: please wait to be called for an immunisation. Your GP practices or hospital have the data and they will contact you, and you will never ever be asked to pay for a COVID vaccine from the National Health Service. We've again picked up some stories about people being asked to pay for some sort of service linked to a COVID vaccination. That is an absolute scam. It will not have come from the NHS, and please be really, really careful about that. So I suppose the summary is that we can see some improvements in our hospital data, we can see some gradual decline in the community data, but we've got used to high numbers and they are still high, so we need to remain vigilant. We will keep going with our vaccination programme. We'll pick up ever more elective care as we can ease off our COVID beds. Remember, we escalated to 32 intensive care beds and we normally only have 16. We think we might be able to ease that down a little bit over the next week, and I'll update you on that next time. Thank you.